I notice on Facebook that a friend is in China, a cardiac nurse, and she's helping with some of the orphans there. And her husband posted a picture of the most adorable little girl, and he said, "Isn't it a shame that she doesn't have a family?" The heart condition that they diagnosed her with was inoperable in China. I immediately thought about our success with Loma Linda and how cute a little girl would be in between our two boys. And so I showed Sean the picture and I was like, "Look, we should adopt her."
And I said, "Are you crazy? We just went through 2 heart surgeries with Vinny. You want to do that again?"
3 years earlier, Sean and Bethany had celebrated the birth of their first child, but it wasn't long before they realized that something was terribly wrong.
When I saw Vinny's heart on the echo screen, it just looked like a jack-o'-lantern. There were holes and flaps all over the place.
Vinny was born with something we call univentricular heart disease. Really means half of his heart isn't represented. So he's living off one pump.
When I found out Vinny's heart was abnormal, I was crushed. Absolutely crushed.
By the time Vinny was 2 years old, he was facing his second open heart surgery. Fortunately for Vinny, he was at the hospital that pioneered the type of surgery he needed for a faster recovery and a chance at a longer life.
We pioneered here in this hospital the idea of, instead of using plastic tubes, we observed that the heart sac itself was right next door. Why not just roll that over and make a tube of that? And we've continued to use it with superb outcomes. If Vinny hadn't had heart surgery available to him, reconstructive surgery, he would not have lived long at all.
When he came out of surgery, they were rolling him past in the cart, and he was singing "Jesus Loves Me." And I was like, all right, he made it through.
He had a different color. He was glowing. His lips were pink. I remember picking up his feet and going, "Oh, they're warm."
Yes.
For the first time.
After the surgery, 1 week post-op, he was sitting outside picking flowers. You know, first-time parents, you're like, "Oh yeah, this is how active our baby is." You think it's normal. He has his heart surgery and now all of a sudden he's bouncing off the walls. Oh, that's what a normal 2-year-old does. Got it.
Nine months after Vinny's second surgery, Sean and Bethany stumbled across a picture of Sabrina on Facebook. She was in an orphanage in China, dying from heart disease.
We could give her a loving home. We could give her an older brother who knows exactly what she's going through, who has a matching scar. And as long as we had the help from Loma Linda, we knew that she could have the long life that God had intended her to have.
It only took about 15 minutes to realize all of my reasoning for saying no was selfish. So then I came back and was like, let's do it. Let's get her.
Adopting a child with special needs can take 2 to 3 years, and her adoption took place in 9 months.
We didn't know how serious Sabrina's condition was. We were told that maybe she could live to the end of January or into January without her surgery. We brought her home December 28th.
Soon after Sabrina arrived in California, she was rushed to Loma Linda University Children's Hospital, where doctors prepared her to undergo surgery. But her heart problems were complicated.
Now, her heart disease was sufficiently complex that we thought we might want to try a slightly newer, different approach. And so we reached out and brought one of our former trainees who has become the head of surgery at Toronto Sick Children's Hospital down here to operate with us because he had been doing some of these operations himself there in Toronto.
After 6 long hours in the operating room, Sabrina's surgery was complete.
So everything came out even much better than we had anticipated.
Sabrina's a little fireball. She is feisty, and she is a fighter, and she is very independent.
What's the chance the little orphan in China is going to get out of China to Southern California, to Loma University Children's Hospital, into an operating room, and end up with a heart that potentially can keep her going for a lifetime? What are the chances?
Vinny is almost 5 years old now, and he is very smart. We started him in pre-kindergarten at 4.5.
Vinny doesn't let his heart limit him.
Now I'm way up on the head. I'm Sabrina.
How old are you, Sabrina?
I agree.
Loma Children's Hospital is like heaven on earth. Because in heaven, everyone's going to be made well. And while at Loma Linda, not everybody's going to be made well, they're going to be made as well as you can be. It gave us a family.